In this presentation, we will talk about the heart and how it works and some of the mechanics involved with it. So first of all, just kind of an introduction on cardiovascular system. It consists of the heart and blood vessels. So the heart's a hollow cone-shaped muscular pump, and it generates force to transport respiratory gases and nutrients and waste through the body. The blood vessels, of course, transport blood throughout the body. Arteries in particular transport blood away from the heart. Veins transport blood toward the heart. Capillaries transport blood between the arteries and veins and perform nutrient, gas, and waste exchange. So they provide the nutrients and gases to your tissues, and then they take the waste products off of it. We talk about two closed circuit pathways included in the cardiovascular system. You have the pulmonary circuit that carries oxygen-poor blood from the heart to the lungs. It drops off carbon dioxide, it picks up oxygen, and it flows back to the heart. The systemic circuit transports oxygen-rich blood nutrients to the body cells. It removes waste from the cells, and it flows back to the heart. The organization of the heart includes a right side that pumps to the pulmonary circuit, so blood returns to the left side. And then the left side pumps to the systemic circuit, and blood returns to the right side. And remember, right and left based on anatomical position. Okay, so this shows your entire cardiovascular system. Again, you have the heart in the middle. You have the pulmonary circuit to and from the lungs, and then you have the rest of the circuit that carries blood to your tissues and back to the heart. Okay, let's talk about the heart specifically. So the heart's the size of your fist. It varies though with body size. It averages 14 centimeters long, 9 centimeters wide. It's located inside the thoracic cavity, in the mediastinum, behind the sternum, and above the diaphragm near the lungs. So it is central. It has a broad base that lies beneath the second rib. It has a pointed apex that lies at the fifth intercostal space. It's a hollow cone-shaped organ, and it contains a double pump. It's divided into left and right halves. So this is what the real heart looks like. If you're looking at it from an anterior view. Okay, this shows where the heart is situated. Okay, we've talked a little bit about some of the serous membranes, but let's go into more detail here. So the pericardium, or the pericardial sac. It's a covering over the heart and the proximal ends of the large blood vessels. And the portions of the pericardium include the fibrous pericardium, which is the tough outer layer that surrounds the double-layered serous membrane, and the parietal pericardium. This is deep to the fibrous pericardium. It's the outer layer of the serous membrane, you'll remember. And then the visceral pericardium. It's the inner layer of the serous membrane that's actually attached to the surface of the heart. And we can also call it an epicardium. Then you have the pericardial cavity, which is a space between the visceral and parietal layers of the serous pericardium. Okay, so this shows those membranes. Here is a blown up picture. Again, the fibrous pericardium, parietal, there's the cavity, and the visceral pericardium. And then the heart itself, the myocardium, which is the muscle. So the heart wall has three distinct layers. The epicardium, which is the outer layer, it's thin. That's the visceral pericardium. It reduces friction. Okay, next you have the myocardium, working your way inward. It's a middle layer. It's the thickest layer. It's composed of cardiac muscle tissue. And then the endocardium. It's an inner layer, which is thin. It forms the inner lining of all the heart chambers. Okay, and this is a diagram, a picture of what the heart wall looks like. Again, fibrous pericardium, parietal pericardium, pericardial cavity, epicardium, which is the visceral pericardium, myocardium, endocardium. Okay, in table 15.1 here gives you the general descriptions of each of those parts and talks about the function of each of those parts. Let's talk about the heart chambers and valves. So the heart chambers include the atria and ventricles. The atria are the thin-walled upper chambers. They receive blood returning to the heart. Then the auricles are flap-like projections from the atria, which allow atrial expansion. And then the ventricles, which are thick-walled lower chambers, and they pump blood into arteries. And there's 4 chambers of the heart, really. We have the right atrium that receives blood returning from the systemic circuit, from the superior and inferior vena cava and the coronary sinus, and it pumps blood to the right ventricle. The right ventricle receives blood from the right atrium, pumps blood to the lungs. The left atrium receives blood from the pulmonary veins and pumps blood to the left ventricle. And the left ventricle receives blood from the left atrium and pumps blood to the systemic circuit. Structures associated with heart also include the interatrial septum that separates the left and right atria, the interventricular septum that separates the left and right ventricles, the superior and inferior vena cava, which return oxygen-poor blood to the heart, the tricuspid valve that separates the right atrium from the right ventricle, the pulmonary semilunar valve that separates the right ventricle from the pulmonary trunk, the mitral or bicuspid valve that separates the left atrium from the left ventricle, the aortic semilunar valve that separates the left ventricle from the aorta, the chordae tendineae, which are fiber strings that attach the cusps of the tricuspid and mitral valves to the papillary muscles in the wall of the heart, and then the pulmonary veins, of which there are 4, that return oxygen-rich blood from the lungs to the left atrium. Okay, and you want to get to know these diagrams very well. Okay, again, we have right atrium, left atrium, right ventricle, left ventricle. Okay, here we have the superior vena cava, the inferior vena cava. Here we have the aorta. And here we have the pulmonary trunk. So the superior and inferior vena cava return blood to the right atrium, which then sends blood down to the right ventricle. Okay, that goes through the tricuspid valve. The blood is then sent up to the pulmonary artery and to the lungs, comes back through the left pulmonary veins and the right pulmonary veins into the left atrium, through the mitral or bicuspid valve to the left ventricle, and then up to the aorta. Okay, and I should have mentioned there are pulmonary valves that restrict the blood flow into the lungs, and there's an aortic valve also, which is not shown here. Okay, this shows a photo of the tricuspid valve. And notice that chordae tendineae hold the flaps into place, and what we call the heartstrings. Okay, skeleton of the heart. Rings of dense connective tissue surround the origins of the pulmonary trunk and the aorta and the orifices between the atria and ventricles. It provides attachments for heart valves and muscle fibers. It prevents excess dilation of the heart chambers during contraction. So these rings, along with the other fibrous masses in the interventricular septum, make up the skeleton of the heart. Okay, here you see the heart valves and skeleton looking at the heart from a superior view downward. And you see we have the tricuspid valve here and the bicuspid valve here. And then behind that we have the aortic valve and the pulmonary valve. Okay, this shows the orientation of the heart valves when the blood is flowing into and out of the ventricles. So these are the pulmonary veins that are bringing blood back into the heart that's oxygenated because it's coming from the lungs. You see it goes through the mitral valve into the left ventricle. Okay, and here it shows the blood moving up through the aortic valve and into the aorta. And when there's not a lot of pressure in here, the valve closes. But when there is plenty of pressure, as you see here, when we actually are contracting the myocardium and the ventricles push, they open up the aortic valve and they close the mitral valve. Okay, you want to get to know the valves of the heart very well. This is a good table to get to know. Okay, let's talk about blood flow through the heart, a little bit more detail in lungs and tissue. So oxygen-poor blood from the vena cava and the coronary sinus enter the right atrium. Blood flows from the right atrium through the tricuspid valve into the right ventricle. The right atrium contracts, sending the remaining blood into the right ventricle. The right ventricle contracts. The tricuspid valve closes right atrioventricular orifices. As the pressure rises in the right ventricle, the pulmonary semilunar valve opens. The blood flows into the pulmonary trunk. Then the blood flows to the lungs, drops off the carbon dioxide, picks up oxygen. Then the blood returns to the left atrium via the pulmonary veins. The blood flows from the left atrium through the mitral valve into the left ventricle. The left atrium contracts, sending the remaining blood into the left ventricle. The left ventricle contracts. The mitral valve closes the left atrioventricular orifice. And as the pressure rises in the left ventricle, the aortic semilunar valve opens. The blood flows into the aorta, transporting the oxygen-rich blood to the body cells. And you'll want to watch some of the videos that I've posted in your course so you can see this animated. I think that'll make all the difference in the world to you to help you to remember how the heart contracts and relaxes and how the blood flows through the heart and how the valves respond to those different pressures. And this is a particularly good diagram also to understand the flow of the blood. Okay, this is a blood flow diagram that just uses the terminology and the parts. So this may be of benefit to you as well. And notice that in these pictures and diagrams, we use red to show oxygenated blood and blue for the deoxygenated. Now, the heart itself, its tissues have to have a blood supply as well, and also a way to drain the heart tissue. So we have the left and right coronary arteries that supply blood to the tissues of the heart. The coronary arteries are the first two branches of the aorta. The branches of the right coronary artery include the posterior interventricular artery that supplies the posterior ventricles. Then the right marginal branch, it supplies the right atrium and ventricle. As far as branches of the left coronary artery, we have the circumflex branch, supplies the left atrium and ventricle. We have the anterior interventricular or left anterior descending artery that supplies the walls of the ventricles. The cardiac veins drain the blood from the myocardium. The paths of the veins lie nearly parallel to those of the coronary arteries. The coronary sinus is the enlarged vein into which other cardiac veins drain, and this drains into the right atrium, back into this full circuit. Okay, and this shows you the openings of the coronary arteries to the vessels that supply the tissues of the heart itself. And this shows basically the blood vessels on the surface of the heart. As you can see here, we have the anterior cardiac veins, the small cardiac vein, the right marginal branch. Over here we have the left coronary artery, the right cardiac vein, the anterior interventricular artery. And then if we look at the other side of the heart, you can see the coronary sinus, but you can also see the circumflex branch and the great cardiac vein. And on the other side, the middle cardiac vein and the posterior interventricular artery. This diagram shows the blood supply to the heart tissues. Okay, the heart actions. So heart actions include systole and diastole. Systole is contraction of the heart chamber, where diastole is relaxation of the heart chamber. The heart chambers function in a regulated, coordinated manner. The cardiac cycle is the events that occur during the heartbeat. So first atria contracts, that's atrial systole, while the ventricles relax, that's ventricular diastole. Then the ventricles contract, the ventricular systole, while the atria relax, that's atrial diastole. And then both chambers will relax for a brief time. Okay, the technology. So replacing the heart from transplants to stem cell implants. A heart transplant is a replacement of most of a failing heart with a donor heart. There's a left ventricular assist device. This is a mechanical half heart used in some cases temporarily until a donor heart is available. Then there's an implantable replacement heart. So titanium and plastic artificial hearts do exist that are used in people that cannot have heart transplants and that don't have long to live. Stem cell technology. Cardiac muscle tissue can now be cultured from altered somatic cells or from stem cells, and this could allow stem cell heart patches in the future. Characteristics of the cardiac muscle cells. And we've talked a little bit about the different tissues of muscle. The cardiac muscle cells have one central nucleus and they form a branching network. They also have intercalated discs that you don't see in other muscle cells. This is between the cells containing desmosomes for structural support and a gap junction that helps spread the action potentials through a network of cells that help the heart contract in a very systematic way. It forms a functional syncytium, we say, which is a mass of merging cells that function as a unit. And two such masses exist in the heart. In the atrial walls, this is called the atrial syncytium, and in the ventricular walls, it's called the ventricular syncytium. And this shows you the cardiac muscle tissue and cells. Okay, again, as you can see, it has a branching pattern, and you see these intercalated discs between the individual cells. And again, it is uninucleated versus, say, a skeletal muscle that's multinucleated. You also see the special gap junctions that you'll find at those intercalated discs. Okay, the cardiac conduction system. This is a specialized group of cardiac muscle cells which initiate and distribute cardiac action potentials through the myocardium. Major components of the cardiac conduction system include the SA node or sinoatrial node. This is really what we call the pacemaker that initiates rhythmic contractions of the heart. Then the internodal atrial muscle conducts impulses from the SA node to the atria. We have junctional fibers that conduct impulses from the SA node to the AV node. We have the AV or atrioventricular node that conducts impulses to the AV bundles. It delays the impulse so that the atria finish contracting before the ventricles contract. We also have the AV or atrioventricular bundle of His. It conducts impulses rapidly between the SA node and bundle branches. And the left and right bundle branches, they split off from the AV bundle and conduct impulses to the Purkinje fibers on both sides of the heart. The Purkinje fibers are large fibers that conduct impulses to ventricular myocardium. It conducts impulses to the apex first. You have a whirl pattern of muscles in the ventricles that contract with twisting motion. And this shows that movement of the message, starting at the SA node, going down through the walls of the ventricle to the AV node, to the AV bundle, then to the right and left bundle branches, down through the interventricular septum, and then upward, and eventually into the Purkinje fibers. So the initial contraction starts at the top, goes down, and then up the sides. I would encourage you to watch some of the videos I've provided in your course so that you can see this in action. This is a diagram that shows the path of the cardiac impulse. This shows you the world muscle networks in the heart so that it is able to contract in reaction to the messages being sent up to down and then around. Okay, we can make use of electrocardiograms, which you can say or simplify as ECG or EKG. It's a recording of electrical changes that occur in the myocardium during the cardiac cycle. It's used to assess the ability of the heart to conduct impulses. The deflections in the normal ECG or waves include a P wave. So this is when we have atrial depolarization that occurs just prior to atrial contraction. Then we have the QRS complex. It's basically three waves. We have ventricular depolarization that occurs just prior to the ventricular contraction. We have record of atrial repolarization, which is hidden in the large QRS complex, since the ventricular depolarization is a much larger event. And then we have the T wave. This is the ventricular repolarization that occurs just prior to the ventricular relaxation. Okay, and this shows the movement of the message basically through the heart in contraction and what each part of the wave stands for. So here we have the initial P and then the QRS and then ultimately the T. And again, some of the videos I've provided will go into details about this ECG as well and what each part means. Okay, this shows a prolonged QRS complex, which could indicate an AV bundle damage. So by looking at this particular graphic, we can tell a lot of things about what's going on with the heart. And now, heart sounds. This can tell a doctor about what's going on in the heart as well, or the nurse. So a heartbeat through a stethoscope that sounds like a lub-dub, we say. Sounds are due to the closing of the heart valves and vibrations associated with a sudden slowing of the blood flow during contraction and relaxation of the chambers. So first of all, the lub. This is the first heart sound, or the S1. It occurs during ventricular systole. It's associated with the closing of the AV valve. Then we have the dup sound. This is the second heart sound, or S2. It occurs during ventricular diastole. It's associated with closing of the pulmonary and the aortic semilunar valves. Now, you've probably heard of a heart murmur before. This is an abnormal heart sound derived from incomplete closure of the cusps of a valve. Okay, here it shows the aortic areas and the pulmonary areas, and then the tricuspid area and the mitral area. So where you put the stethoscope can tell you specifically about what's going on in those areas. Okay, this is another good graphic that correlates what's going on with each of the waves and what's contracting at each of those times. Again, some of the animations I provided to you will help understand this. Okay, pressure and volume changes during a cardiac cycle. So during a cardiac cycle, the pressure in the heart chambers rises and falls. So pressure changes open and close the valves. and this happens early in the ventricular diastole. Ventricular pressure is lower than the atrial pressure. The atria and ventricles are relaxed. The AV valve opens and the semilunar valves are closed. About 70% of the blood flows passively from the atria into the ventricles at this point. During atrial systole and ventricular diastole, the atria contract and the ventricles are relaxed. The AV valves open and the semilunar valves close. The atrial systole pushes the remaining 30% of the blood into the ventricles, which causes ventricular pressure to increase. During ventricular systole and atrial diastole, this is when the ventricular pressure rises above the atrial pressure and the AV valves close. The chordae tendineae prevent the cusps of the valves from bulging too far backward into the atria. Then the atria relax. The blood flows into the atria from the vena cava and pulmonary veins, and the ventricular pressure continues to increase, and it opens the semilunar valves. The blood flows into the pulmonary trunk and aorta. Okay, and again, this is showing you what the ventricles are doing at each of these points and the blood flow. Okay, regulation of the cardiac cycle. The heart rate and volume of blood is pumped and it changes to meet the requirements. The cardiac center in the medulla oblongata performs the neural regulation of the heart. The SA node or pacemaker normally controls the heart rate, and the heart rate changes occur due to factors that influence the SA node. Sympathetic and parasympathetic fibers modify the heart rate in response to changing conditions, such as physical exercise, or body temperature, or the fight or flight response, or concentrations of various ions, such as potassium and calcium. Parasympathetic impulses that innervate the heart reach the heart via the vagus nerves. They lower the SA node rate of 100 beats per minute to 60 to 80, and they decrease the heart rate due to the influence on the SA and AV nodes. The sympathetic impulses that innervate the heart reach the heart on the accelerator nerves. They increase the heart rate due to the influence on the SA and AV nodes and the atrial and ventricular myocardium. Baroreceptor reflexes involve the cardiac control centers in the medulla oblongata. They balance inhibitory and excitatory effects of the parasympathetic and sympathetic fibers. And this contains a cardio-inhibitory reflex center and a cardio-acceleratory reflex center. An example of the baroreceptor reflex response is when the baroreceptors in the aortic arch and the carotid artery sinuses detect blood pressure. The increased pressure stretches the receptors, and the parasympathetic cardio-inhibitory reflex lowers the heart rate and blood pressure. The stretch receptors in the vena cava, they increase in blood pressure stretches receptors. And the sympathetic cardio-acceleratory reflex increases the heart rate and force of the contraction to lower the venous pressure. Other factors that affect the heart rate include impulses from the hypothalamus and cerebrum, and body temperature, and levels of potassium and calcium. This is a diagram of the baroreceptor reflex. Okay, clinical applications. Arrhythmias. These are altered heart rhythms, and there's several types. In fibrillation, we have uncoordinated chaotic contractions of the small areas of the myocardium. Atrial fibrillation is not life-threatening. Ventricular fibrillation is fatal. In tachycardia, we have abnormally fast heartbeats of greater than 100 beats per minute at rest. In bradycardia, we have abnormally slow heartbeats of less than 60 beats per minute at rest. A flutter is a rapid, regular contraction of a heart chamber, 250 to 350 beats per minute. In premature beat, the beat that occurs before the expected in normal cardiac cycles, often it originates from ectopic regions of the heart other than the SA node. The ectopic pacemaker, damage to the SA node may lead to AV node taking over, And this acts as a secondary pacemaker, 40 to 60 per minute instead of 70 to 80. Artificial pacemakers are devices used to treat disorders of the cardiac conduction system, implantable, and they're battery powered. Okay, and this picture shows you various arrhythmias like ventricular fibrillation, tachycardia, bradycardia, and atrial flutter. And this is the end of the heart presentation.